And I've already told you that most drug administration occurs orally. So most drugs are given orally, so that the physiology of the GI tract is going to play a major role in the absorption of those drugs that are administered orally. You probably know, I shouldn't say probably, from your physiology, pathophysiology courses, maybe pharmacology or whatever, that physiological membranes are composed of this membrane that consists of a so-called phospholipid bilayer. Mm-hmm. Okay, so that phospholipid bilayer has like the outside and the inside, like the polar heads. Mm-hmm. So it's polar, and then oriented towards the inside of the membrane. We just say this is Feldman's representation of the membrane. So we have, yeah. So the circle part is the polar portion, and then on the interior we have the more lipid portion, and then this membrane is interspersed, boy is trying to get away from it, with proteins, inside the membrane. And those proteins, like you've learned from Dr. Milton and others, those proteins, depending on the amino acid composition and the pH of the environment, they have different charges. Okay, so these membranes, depending on the protein structures, can have different charges or whatever.
Yes, so, they know that.
Yeah. Oh, they're saying that now. As soon as you leave, they're gonna say, Dr. Spell, can you explain that? So so-called phospholipid bilayer. And I think all physiological membranes, all biological membranes are pretty much like this. Now some of them are more lipophilic than others. Like the ultimate example of lipophilic, that's the interior portion, is the blood-brain barrier. For a drug to get into the central nervous system, it has to be really lipophilic or whatever. Okay. But most of the biological membranes are going to have a polar and a non-polar portion. These biological membranes, as I just said, they have proteins in them. So they're composed of proteins. And this is not exhaustive because I believe my notes are old, but I think they got some other stuff in them too. But lipoproteins, these I would say these are probably the more important constituents. They have a polysaccharides in them. I'm trying to write like, so this boy won't do a flip on me. And proteins, lipoproteins. I got one other thing I'm missing. Lipids. How could I miss that? Lipids. So they have some lipids in them. So these are the four major components of this so-called biological membrane. In most instances, the drug is going to cross this biological membrane. Okay, so we have drug on one side of the membrane, and then it goes through the membrane. So this is drug on the outside, and then we have drug that goes across the membrane, drug inside. And usually, that drug is going to go across that membrane by passive diffusion. Now, we'll do physiological, yes. In this section, when we're talking about physiological factors, we're talking about other types of transport across the membrane, like active transport and facilitated diffusion. But in most instances, the drugs will go across by passive diffusion. Okay? And the passive diffusion, if the drug is going to be absorbed or go across this membrane by passive diffusion, then that's dependent upon the concentration gradient. So passive diffusion will go from high concentration to low concentration. Okay. So passive diffusion can't work if this is the low concentration over here and this is the high concentration. If I start out over here, okay, with a low concentration, it's not going to go across that membrane by passive diffusion. It might go by active transport or something, but passive diffusion depends on drug movement from high concentration to low concentration. Okay? That's that so-called concentration gradient that you've talked about in other courses. Fat-soluble or lipophilic compounds tend to go across this membrane more readily than hydrophilic compounds because the membrane is more lipophilic than it is hydrophilic, generally speaking, okay? So compounds that are fat soluble or lipophilic, lipophilic, tend to go across it more readily than drugs that are hydrophilic, okay, or hydrophobic. I would say hydrophobic is lipophilic. Hydrophilic, what's another name for hydrophilic? Water soluble, but there's another name too, you know. If I say lipophilic, that's the same as hydrophobic. So there's a corresponding word for hydrophilic, but I can't think of it, but we know that means water soluble also. Let me see what else here.
It's lipophobic.
Huh?
Lipophobic.
Lipophobic?
Yeah, like fat, like scared of fat.
Lipophobic?
Yeah.
I don't know. You sure?
I ain't never heard that one.
Yeah, you know.
It is.
I mean, I feel my leg jerking.
You can jerk all you want to, but tell me what it is.
You could be right though. Okay. Weak acids, and you know this from things we've talked about, and Dr. Milton and others. Weak acids are going to tend to cross this membrane more readily when they're unionized. Okay, so that goes there, so that's consistent with what you already know. Unionized drugs, I'm saying weak acid, but the same thing would be true for weak bases. Okay, a weak base is going to tend to cross this in the unionized form. Okay, ionized molecules, they might stagger across, but they're not going to be able to readily cross this membrane because of this lipophilic character. In order for the drugs to go across the membrane, for our purposes, we're gonna assume that the drug has to be in solution. So the drug has to be soluble in the GI tract. Now we're talking primarily about GI absorption, but this could pertain to absorption from other sites as well, you know, like muscles and subcutaneous tissue or whatever. But we're leading into that portion of the course where we're gonna get into the pharmacokinetics of drug absorption. And GI absorption just happens to be the most common type of drug absorption. But I don't want you to think that the things that I'm saying pertain only to GI absorption. Oh, and by the way, before I forget, much of this material is found in chapter 14. This is in your lecture schedule also. In chapter 14 of your textbook. Again, if you're following in class, if you're in class, if you're paying attention, you shouldn't have to go and read that, but if something's not clear, whatever the case, please go to the appropriate section of the textbook where they talk about physiological factors in chapter 14. So the drug has to be in solution, okay, in order to cross this membrane, okay? And by solution, we're talking about the GI fluids, mostly lipophilic or hydrophilic, the GI fluids, you would think. The GI fluids in the stomach and intestine, more like water or more like oil? The fluids themselves. Probably more like water, okay? So when we say the drug has to be soluble, we're talking about it has to have water solubility. If it's going to dissolve, we want the drug to be in solution in the GI tract. But also, this membrane has lipophilic character. So water soluble drug, you're probably not going to have much problem getting through these polar portions. But if it's just strictly water soluble with no lipophilicity, no fat solubility, it ain't gonna be able to transverse, go through this inner portion. So the take-home message is that for drugs that are given orally, in order for them to be absorbed across this so-called phospholipid bilayer membrane, they have to have both water solubility and lipid solubility. Multiple choice on your next exam, I'm up here to repeat, how'd y'all miss that? How'd you miss that? Okay, so the drugs have to have water solubility because we have polar heads, and primarily because the GI fluids themselves are mostly water, aqueous in nature. But if it's just strictly water soluble, it won't be able to go across the membrane because of the primarily lipophilic nature of the membrane itself. We already know that the ionized form of the drug is going to be more water soluble than the unionized drug. So that goes back to me saying that weak acids are going to get through here more readily in the unionized form. Weak bases will get through here primarily in the unionized form, okay? Because of the greater solubility of the unionized form. Okay, so I have here my notes. even though the compound has to have both water solubility and aqueous, water solubility and fat solubility to get across the membrane, in practice, what researchers have found is that of those two requirements, water solubility and lipid solubility, the lipid solubility is more important. It has to have both, okay? But the lipid soluble drugs tend to be more readily absorbed. When I say lipid soluble, I mean they're more lipid soluble than water soluble. So those drugs that have greater lipophilic character tend to be absorbed more readily across this membrane than drugs that are mostly water soluble. Okay? So those two properties, it's the lipophilic character that's more important. We talked a little bit about so-called passive. My eraser. Look, I'm offering a reward for the racer. No. I shouldn't say that. I'm offering a reward to whoever turns in the person that took the eraser. I like that better. If you turn me in and it turns out that they're the guilty party, there's a reward. Somebody here took the eraser, all in somebody's purse. Somebody move that eraser.
What kind of reward? Come back and tell
Oh, God, talking about some head go.
I'll go to San somebody else.
That thing's still swinging. Let's talk a little bit about, so that was membrane physiology. I don't know if I'll be able to keep up these numbers like I have it in my notes. So we talked a little bit about membrane physiology. I have these sections numbered, but it's not that important. I'll usually highlight and get there. So passive diffusion. Passive diffusion. I should have left my little membrane up there. So we've already said that in most instances, drugs are going to go across that phospholipid bilayer by passive diffusion. And we've said that passive diffusion, the drug molecules travel from regions of high concentration to low concentration. Okay? So that's generally a characteristic of passive diffusion. Passive diffusion can be described by Fick's first law of diffusion. Fick's first law of diffusion is a mathematical description of passive diffusion, and that law the equation that describes that says that the change in concentration. Okay. Let me just write a membrane again. So here's the membrane. I'm not going to worry about the polar heads and stuff. So the drug is going to go from the outside. This is the membrane, the bipolar membrane. Outside, drug outside. This is inside the membrane. Okay. Drug outside, drug inside the membrane. Once it crosses, okay. So Fick's first law of diffusion basically says that the rate that the drug crosses that membrane is equal to some constant K times delta C. Delta, that's the change in concentration. So let me just put that in parentheses. So that's not an A, that's the change in concentration, which can also be written as K times C1 minus C2, where C1 is the concentration out here on the outside of the membrane. C2 is the concentration inside the membrane. Okay. So that delta C is just the difference between the concentration on the outside of the membrane, C1, minus the concentration on the inside of the membrane, C2. So that's all. So this is the rate of change, and that minus sign here represents the fact that the concentration is decreasing. Okay. And in my notes, I just have delta C, but I'm thinking I should maybe be delta C1, but I'll go back and check that. So right now, just keep in mind that this negative sign here, same as what we've always said, it represents that the concentration is decreasing. So that's why I'm assuming that this C1, I mean not the C1, that this C I believe it pertains to C1, but when you hear me talking about I believe, I'm gonna check and get back to you, or I'm not gonna test you on that or whatever. In my notes, I just have delta C. But that negative sign, you know, the concentration over here is increasing, right? C2 is increasing with time as I go from here to here. So I'm thinking that C pertains to D1, but the take-home message is that a concentration is decreasing, okay, as we have drug diffusion across that membrane. This K is a so-called proportionality constant, and we had that Norris-Whitney equation. In this case, the K, it incorporates a diffusion coefficient. All of these are components of K. A diffusion coefficient. It incorporates the partition coefficient. It incorporates the thickness and the area of the membrane. Thickness of the membrane and the membrane area, surface area. Okay. So kind of like when we were talking about the Norris-Whitney equation, the diffusion coefficient has to do with kind of like the viscosity or whatever. Remember I put on the board syrup versus water, whatever the case may be. So this membrane has a diffusion coefficient. It has a partition coefficient. That partition coefficient has to do with the tendency of that drug to stay out here. Well, I diagrammed partition coefficient also on the board the other day when I had the drug in the beaker and the oil and water layer. So the drug out here will kind of like represent the drug in the water layer outside, and then the tendency of the drug to equilibrate as it goes inside the membrane will represent the oil layer. So you got water, oil. And the higher the partition coefficient, think about this for a moment. The greater the partition coefficient, okay, the greater the tendency is for that drug to stay outside of going into the membrane. Based on what I just said and what we talked about partition coefficient. The greater the partition coefficient, is that drug going to want to go into the membrane and cross it, or stay outside here? Maybe in the dosage form, in the pharmaceutical prep, in the tablet or the capsule or whatever. The higher that partition coefficient, is that going to tend to cause the drug to go inside the membrane or stay outside the membrane? If I say this is the aqueous part outside, and this is like that membrane has this lipophilic component, what would increase the partition coefficient do? Okay, these kind of questions I'm going to be asking you. Again, if you're just sitting here, if you're not thinking, trying to, knowledge, understanding, application, then you're going to keep on struggling on the exam, okay? Partition coefficient has to do with, if I say this is the water, and this is the oil, or whatever the case may be, I mean, it's kind of like that, or whatever. But partition coefficient is the ratio of drug in the oily part to the, we said partition coefficient. Oil is on top of water. The higher the partition coefficient, okay, the greater the tendency is for the drug to be on the oil layer. So the higher the partition coefficient, the greater the sports fan. I just want you to think. We've had 3 now. Yeah, it's some straight out memorization question. But here's a question now that you apply what we just talked about the other day and what I just talked about again today. So that drug, okay, the higher the partition coefficient, okay, the greater the tendency is for that drug to go into the side of the membrane. I mean, if you want to just flip this whole thing over, but I mean, that would, if you answer that question, if I had asked you that on the question, you answer that question, without me having to explain it to you, then that's showing me where you understand the idea of partition coefficient. Mm-hmm. So partition coefficient is part of this constant, the thickness of the membrane. Okay. If I apply the cream or lotion or an oil or an ointment to, let's say, to the face, versus applying that same cream or ointment with a drug in it, okay, like you learned about in dosage form, to the sole of the foot, with everything else being similar, which one of those body parts would that drug probably go through faster?
The
Here,
face.
on my face, or on my foot?
The face.
Probably the face, because the skin on the sole of my foot, okay, is thicker. Right, so drug, you know, if I got drug going across this membrane versus drug going across a membrane like that, okay, it's gonna get across this one faster with everything else if everything else is the same. Okay, so the thickness of the membrane is important. And then the area of the membrane. I don't even have to talk about area too much, because you know the main reason that drugs are so highly absorbed from the gastrointestinal tract is because of surface area. You got that huge surface area in the small intestine. Okay, I think I read one time, but don't quote me on this, that the small intestine could be, you know, stretched out. Don't quote me on this, but I think it'd be about the length of a football field. That's a lot of area for, you know, for drug absorption to occur. Okay, so that's K, and again, this delta C is just the difference between the drug concentration on the outside versus the inside. Again, right now, we were just considering passive diffusion of drug across the membrane. So in my notes, I also have here that, let me erase this thick membrane. It's taking too much space. Hold up, board. $800. I know, brother, right over there in Kenny Holmes could have got me a board like that for $20. $20.
I see where you buy everything. You got TVs?
We got this for $20, and then we could have split the $750. We wouldn't have. Okay, so
I think your math was off, Dr. Filter, but we want to go proceed.
when you talking about the price, the charge?
Yeah, you said $20 and $750.
Oh, you're right. It would have been $780, right? Thank you. Thank you. Yeah, but I did do that.
Ain't no tax over there.
Yeah. But thanks for. Okay, so here's another important thing too, is that in the body, in a real physiological situation, let's say GI absorption, and when that drug gets on the inside, so this is the side that the blood is on. I mean, it don't go straight into the blood. It might have to undergo across some other membranes too. But the blood is on this side. When that drug goes from here in the GI tract to on this side, the concentration of that drug is ultimately over here, C2, is ultimately going to be swept away by the drug being distributed into, remember that phrase we learned about, volume of distribution? In other words, when it gets on this side, you know, the physiological process in the body is going to carry a drug away, and it's going to be distributed throughout that huge volume of distribution. So C2, the concentration of drug over here, tends to be lower and to stay lower than the concentration up here, C1. Because once the drug gets over here, it distributes throughout, you know, the rest of the body, and that's what determines, you know, how large the volume of distribution is, whatever the case may be. So in that case, then this fixed first law, when C2 is much less than C1, when C2 is much less than C1, I won't write much lower than that, then this equation can be represented.
Is it still under first?
Yes, it's first order.
Oh.
But it's going to look even more like a first order process when C2 is much less than C1, because if C2 is small, then that's just K times C1. So we basically have the same equation that we learned about for first order kinetics. That's why passive diffusion a lot of times is described as first order, but this just says that the rate is equal to K times concentration. That's pretty much the same equation that we had when we talked about the IV bolus dose with first order elimination. We had delta A over delta T is equal to K times A, but if we divide both sides by volume, then we can express the rate equation in terms of concentration. So this is the equation for first order kinetics. Okay. When this C2 is much less than C1, we have what we call, can refer to as sink, S-I-N-K, just like your kitchen sink, sink conditions. Sink condition. I said I wasn't going in lower, so don't let me write in the lower, but I'm trying to also say what I write. So when that C2, when this concentration over here is much less than C1, which tends to happen with drug absorption, then we have sink conditions. And you can think of it just like water going down the sink. In other words, water coming in, but it's going down the sink because C2 is being swept away. C2 is not building up over here. It's distributing into the other body, tissues, organs, and fluids to create a so-called volume of distribution. So when that happens, we have sink conditions, and that is essentially the same as a first order kinetic process. It's the same as the first order process. Okay, I got that. First order. Okay. All right, so I think I'll move on, but so this equation just basically says that the rate of absorption is proportional to this K. I don't know if I told you this when we were doing the one compartment model with IV bolus dose, but sometimes this K is referred to as a proportionality constant. Sometimes, but it's more appropriately referred to as a first order rate constant. We calculate it the same way, but in this case, I want you to recognize that this proportionality constant K, or first order rate constant, has all of these things that's combined in it. It's going to have units of reciprocal time. Yeah, it should have units of reciprocal time, just like any other first order rate constant. And again, C1 is just a concentration on the outside of the membrane. Is C1 constant or C1 changing? I'm seeing another multiple choice question. According to Fick's first law of diffusion, this question just occurred to me. Is C1 constant or is it changing? It's changing, okay, but based on what we talked about, yeah, the C1 is changing, so I don't want you to see that as a constant. What about K? Is K constant or is K changing?
Constant.
K is a constant, okay, a proportionality constant or first order, we could just call it a diffusion rate constant. In my notes, I just have proportionality constant. But it's pretty much the same as the first order rate constant. Would that constant be the same for all drugs?
No.
Just first order.
Okay, good, very good. And we've already said that it's gonna change also based on, it could be the same drug product, but if we put it on different parts of the body, then some of these things will change. Like the face versus the sole of the feet, the sole of the foot will probably have different diffusion coefficient, So that K is gonna change depending on the circumstances. Certainly it'll change with the drug preparation. If I gave a drug in an ointment versus the same drug in a cream, all of these things could change, even though it's the same drug, but it's a different drug formulation. All right, very good. Fick's first law of diffusion. There's also, in addition to passive diffusion, we have carrier-mediated, I'm gonna say three here. Carrier-mediated transport. Carrier-mediated transport. And the two main types of carrier-mediated transport that I'm going to talk to you about are active transport, and so-called passive facilitated diffusion. So I'll write them up here. Okay. Because next test, now you don't hear me talking about tests that often, but the reason I'm bothering with you guys now is because I want us to come up. Seriously. So next test, okay, if I'm telling you now that the two main types of carrier-mediated transport are active transport. We're gonna talk about that, and facilitated. I think it's facilitated diffusion, but it seems like it's another word in that. Passive facilitated diffusion. Passive facilitated diffusion. Passive facilitated diffusion. passive facilitated diffusion. Okay, so when I write this multiple choice question, and I already know that I want two of the distractors, that I already got two of them to transport with T. Now I got to come up with three more for A, B, C, D, and E. So I'm gonna start imagining stuff. You know, of course I'm gonna throw passive diffusion in here too as one of them. Okay, so the two major types of carrier-mediated transport are A, active transport. Just letting you look at my mind. A, B, okay. C, passive diffusion. Y'all laughing now, but when I stand up here 2 weeks from today and say, how'd you miss that? It ain't gonna be funny no more, okay? Passive, and I don't mind you laughing now because it is funny right now. But this is the kind of stuff that some of us are messing up on. And then D, I'll write active transport. The stem says the main type of carrier mediated transport, okay. Or the main type or types, you know, active transport and passive diffusion. Passive diffusion. And passive, active transport and passive diffusion. A, B, C, D. Now E, see, this is where I get stuck. You know, this is where I have to take another sip. Okay.
We don't need no E. We need remediation questions.
I understand that some instructors just give four choices or whatever. Sometimes when I can't think of an E, I'll just have four, but that's very rare. But there have been times when I could just come up with four. Passive and okay, you know, I get stupid sometimes. Tiger train transport. Somebody go for it. Somebody go for it. But it's so stupid. It's so stupid. Okay.
He said, I'm gonna get one of y'all. He said tiger in class.
He said tiger in class.
Okay. So what would a good stem for this be? What would a good stem if, you know, A and B are the types of carrier-mediated transport that I want to talk about right now. So I need to put tiger. If the stem is going to say the two types, then I need to get a good stem for this or whatever. But the bottom line is that the two major types of carrier, there might be the two only types, but the only two types, but the two that I have in my notes that are most important are passive facilitated diffusion and passive diffusion.
You know, facilitated.
I don't think you should get passive diffusion.
Good. Okay. So D is a pretty good distractor. No, the two major types, I did that on purpose. Okay, are active transport and passive facilitated diffusion. But somebody's going to choose active transport and passive diffusion too. Somebody go for D. E, if anybody goes for that, we're gonna give them an early vacation. They ain't gonna have to come back to that. You know, I had we have on the faculty a visiting professor. I can't remember her name, but she reviews for those faculty members that want her to. She reviews the questions prior to make suggestions. She's real good with it. So on your second exam, one of the questions, I forgot what it was, but she saw my questions that had been uploaded to ExamSoft, and she sent me an email suggesting that she started out saying, Dr. Felder, this is too easy. Why not, change one of the distractors. But I left it just like it was. It was a stupid distractor or whatever. You know, I believe that you know, a long time ago when I went to a writing questions workshop, and I'm not the best question writer, but I write better than some of this stuff I've seen. But it's good to have some icebreaker, you know, some questions, you know. So yeah, we can rule out E or whatever. D probably would be a pretty good distraction. Some folks would go for D, okay? But the correct answer here would be the combination of A and B. So I would have to have one where I said, you know, active transport and passive facilitated diffusion as the two major types. Okay.
Thank you for the 2 points.
Okay. Anyway, I wasted more time on it than I intended to, but I just wanted to give you a look at, you know, a lot of times when I'm lecturing, I am, you know, thinking of multiple choice questions that I can write, and what I'm trying to do here today, and a couple of other lectures, I was saying on the next test, this is what I could do, this is what I could do. I'm trying to get some of you all that are just here but not here to think, okay? And not just be sitting there recording the lecture or writing notes, but to think about some of the things that could be asked of you. So carrier mediated transport. And I'll take 5 more minutes and I'll finish this up on tomorrow. Facilitated diffusion. Let's talk a little bit about facilitated diffusion. Facilitated diffusion. Facilitated diffusion is carrier mediated, but like passive diffusion, facilitated diffusion, even though a carrier, you all understand the concept of a carrier, right?
Yes.
I like the way you said that with persuasion, because in my mind I'm thinking, you know, students gonna say, I ain't never heard of that before. I ain't never heard. Okay, so with the carrier, with the carrier, there's going to be usually it's a protein type molecule that locks onto the drug, interacts with the drug out here on the outside of the membrane and carries it across the membrane to the inside of the membrane, and then the carrier detaches, dissociates, and then it recycles, you know, back to the outside of the membrane. So don't ask me any more about it because I don't want to embarrass myself. That's the extent of my knowledge, but that's all we need to know right now.
Done with energy?
Huh?
Did you do with energy?
No, the facilitated diffusion, okay, well,
I think it's partial.
I don't know if facilitated passive diffusion requires cellular energy or
That's
not.
different from
I don't think it does.
facilitated.
Oh, this active? Okay.
That's active. I know active does, facilitated diffusion. I don't think it does. It certainly wouldn't require as much as active transport.
That's why I need the
Okay.
carrier because they got no energy.
Yeah.
Okay. This process, it is a saturable process. What do I mean if I say it's saturable? It's a saturable process. Facilitated passive diffusion. I should have put passive facilitated diffusion. Put that in. I have passive facilitated diffusion in my passive facilitated diffusion. I just put facilitated diffusion. And in our discussion, I'll probably just keep saying facilitated diffusion, but a more accurate designation is passive facilitated diffusion. What do I mean when I say that our process is saturable? You guys, I'm impressed so far, you know. I mean, you all just had this yesterday? No, you had a test yesterday. It seems like you know what's going on. If I say that process is saturable, putting somebody in your own words, tell me what that means.
A lot of concentration?
What's that again? Come on, if you talk about these processes, now you had to, wherever you talk about them, you're not hearing this for the first time. You shouldn't be hearing it for the first time. You're hearing it for the first time, somebody didn't do their job. If in fact you're hearing it for the first time. If it's saturable, that means out here you only got a limited amount of that carrier. So if you keep on increasing the concentration of drug, which we could by giving a bigger, larger dose of the drug, then we can get to the point where if we only got this many enzyme molecules, carrier molecules, and we got a boatload of drug molecules, okay, this rate of drug transfer across this membrane can get to the point where it can't go any faster because all the drug carriers are tied up because of the high concentration. So the higher the concentration is, and we're going to talk more about this in the course when we talk about dose-dependent pharmacokinetics, the higher the concentration is, then the closer and closer and closer we get to saturating this process. Saturation just basically means that, hey, all the carriers are fully occupied and this rate is still proceeding when it's saturable. Another multiple choice question. The transfer, if this process becomes saturated, the process keeps on going. It's just going as fast as it can. It can't go any faster because all of those enzymes, okay, are busy, carrying drug across the membrane and recycling. Just think if the drug concentration was real low and I had an excess of enzymes, okay, those carriers would be saying, hey, send me some more, and the rate of drug transfer would be even faster if I had a low concentration of drug and a whole bunch of enzymes. But if I saturate those enzymes, I'm saying enzymes, but carriers, if I saturate those carriers, then they're going to be working at full capacity. That process of drug diffusion, passive facilitated diffusion is going to be going at its maximum rate. It's saturated with high concentration of drug.
Maximum rate with high concentration.
Yeah, it's saturable. So I'm not saying it's saturated all the time. For it to become saturated, it depends on, first of all, how many carriers, what's the extent of the carriers, but we don't have any control over that. But we do have control over the drug concentration on the outside of that membrane. So the higher that concentration becomes, the closer I'm going to get to saturating that process. Okay. I have in my notes that vitamin, I know in the textbook they give a whole lot of other examples. I'm not wholly responsible for that. But I do have in my notes that vitamin B12, a supplement. Vitamin B12, vitamin B12 is absorbed by this process. And that's why, some of you all might take B12 shots. You can get them parenterally, but I think they have a product called B shots or something like that you can take orally or whatever.
To give you energy.
Okay, yeah, it's supposed to give you energy. But a lot of times, for old folks like me, it don't give me as much energy. Because what happens a lot of times as we get older, and some younger people too, as we get older, that those molecules that I'm saying that's responsible for carrying this, they become less and less, less and less active.
So y'all lose like
Not
protein
able to
binding
bind?
things?
Right, and carry it across.
Okay.
So, that's why, but even if some young folks, they'll tell you that, you take those oral B12 and B12 complexes and stuff like that. Some experts say, that to a great extent, you're just kind of wasting your money if you're not sure that it's being, absorbed, as a result of a lack of that molecule, that carrier molecule or whatever. That's why, with those B12 and B supplements, whatever, you got oral formulations. How do I want to say this? You got formulations that are designed to be swallowed, but you also have those sublingual formulations, that would, bypass this process, and from a sublingual formulation, it's going to go straight to the portal circulation, and if it's not undergo a first pass effect, then it'll get into the bloodstream more readily. So that's why we have those sublingual formulations as well. Of course, you got the B stuff that they give parenterally also. So. All right, very good. And then we have active transport. We have active transport. And active transport, okay, let me repeat again, for passive facilitated diffusion goes with the concentration gradient. So it's got to go from high to low. Passive facilitated diffusion. That's important. Passive facilitated diffusion is going to go from high concentration to low concentration. So I'm thinking that you guys are right when you say it doesn't require any energy. I don't have that in my note, but it probably will work just like passive diffusion as far as passive perfusion doesn't require any input of cellular energy. Probably the same thing here, you know, just, you know, thermodynamically speaking, or whatever, I forgot what the right term is, you know, but, you know, if you know, if I come in here with some cheap cologne on and I've sprayed it all over my body, okay, it ain't gonna take, you know, the concentration of that cologne up here is high, but eventually it'll diffuse back there to the back of the classroom also, okay, that doesn't require any additional, you know, external energy for that to happen. It's just, you know, happening just like passive diffusion. With active transport, okay, the drug molecules are gonna go across that membrane from from low concentration to high concentration. So with active diffusion, with active, I don't want to say active diffusion, active transport, okay, you know, cellular energy is required, but that cellular energy is going to be used to push drug across that membrane from a low concentration. It can go against the concentration gradient. Active transport, okay. It does proceed against the concentration gradient. Again, it does require cellular energy also, okay. It's saturable, okay. So it's saturable, let me say saturable also. And for certain, it requires cellular energy. It requires cellular energy. Okay. Energy. Energy is jacked up there, but that's a saturable process and it requires cellular energy. Some examples of drugs that undergo active transport are 5-fluorouracil, 5-fluorouracil, some of the cephalosporins, I don't know if I'm spelling that right, but I don't, cephalosporins, is that right, you pharmacology expert? Cephalosporins, is that spelled correctly?
Look right to me.
It look right, yes.
Okay. And another non-drug, but another supplement, riboflavin. Isn't riboflavin a B vitamin also?
Yes.
Isn't that one of the B vitamins?
Yes.
Part of the B complex, riboflavin. So these are three examples of compounds that are absorbed from the GI tract by active transport.
Okay.
Again, there are a host of others in the book. I'm not requiring you to know that. I just want you to know that, hey, these are the two main processes, and here are a few examples of compounds that are absorbed by those processes, okay? All right, so I'm gonna stop right there, and we'll continue on tomorrow.
Can I continue live?
What I have, gastrointestinal physiology. So we'll start on tomorrow talking about some gastrointestinal physiology, like GI motility. It only makes sense that, you know, the small intestine and the stomach, they're not static, they're moving. So we have gastric emptying from the stomach, drug gets into the small intestine, it's moving down the small intestine, it's not just staying there. So those are the types of physiological factors that we'll cover on tomorrow. I designated 3 days for this section here, but we may be able to finish up tomorrow and do something else on Friday. We'll see. Hi, Dr. Boone, how are you? I'm finishing up. I'm finished, as a matter of fact.
Dr. Foster, what are you doing today live?
I'm still thinking about that. I have a couple of ideas.